See, what is this condition? Look at the picture. Here RBCs are shape of the RBC changed. Yeah, it is considered as sickle cell anemia. What is the complication in it? What is the complication in it? This is the complication. What is this? Yes. What do you think in the complication and associate with another?
BC.
Yeah, here what happens? The thrombus, abnormal shaped RBCs start forming a thrombus within here. Okay, within the blood vessels. So it may obstruct the normal circulation. See, usually RBCs are freely, which is moving through the blood vessels. When it causes like a abnormal shape, it causes thrombus formation. Thrombus will be formed in between the cells and it alters the normal circulation and it causes ischemia. And what is the complication of this? Complication of this thrombus. It causes vaso-occlusive crisis. What is it called as? Vaso-occlusive crisis. What is the sign of vaso-occlusive crisis?
Severe pain.
Severe pain. What is this? Pavlik harness. Okay, this is called as Pavlik harness. And this is usually used to treat hip dislocation or congenital hip dysplasia. Congenital hip dysplasia and hip dislocation that can be treated by using Pavlik harness. Okay. So when you get a question and in that the child is on Pavlik harness, you have to just think what is this Pavlik harness. This is usually given or it is used as an assistive device or a supportive device to immobilize the hip, and that will enhance the entire movement of the hip even after the procedure or even after the disease occurrence. What is this disease? Hip dislocation. What is the basic reason for hip dislocation? Congenital hip dislocations. What is the reason for congenital hip dislocation? I want all of you to write down these things. What could be the reason? What is congenital dislocation? While the baby comes out, hip dislocation. See, hip dislocation can be acquired and congenital. So congenital is basically because of breech presentation. When the baby's presentation is a breech presentation where buttocks is the presenting part. What happens when the uterus contracts? The pressure from the upper part of the uterus, which always gives more pressure towards the hip. So there will be chances to get a dislocation of hip. So breech presentation causes congenital hip dislocation, and that can be treated by using basic reason for hip dislocation is breech presentation. So you have to write down this. Okay. See, this is a breech presentation. So in breech presentations, the continuous pressure from the upper part of the uterus, it gives towards the hip, and the pressure increases towards the hip, and there will be better dislocation. Have you heard about Bishop score? Bishop score. Bishop score usually used to identify or to read cervical dilation, effacement, and which is usually helping the healthcare provider to initiate induction of labor and how would the effectiveness of normal labor is going on. Okay, so Bishop score is usually that is a scale which is used to assess the cervical dilation and how effectively the patient is moving through the labor process. Okay, so which include, see why this is considered as a Bishop score. It is invented or scored initially. It was done by Edward Bishop. Okay, and which include cervical dilation, effacement, consistency, and fetal station. Okay, what is fetal station? It is relationship of the presenting part with denominator of the pelvis. What is that denominator of the pelvis? Yes.
Ischial spine.
Ischial spine. Very good. So, fine. Next question. What is this procedure? Look at the picture and tell me what is this procedure? What is this indicating? This is pudendal nerve, the yellow one. Pudendal nerve, and healthcare provider is giving injection to the pudendal nerve. Oh, some injection, yeah, yes. What is this called as? Pudendal block. When would you give pudendal block? Yes. When would you block pudendal nerve? Or when would you administer said injections to pudendal nerve?
At the time of episiotomy.
Yeah, just below the, just before episiotomy. Okay. So, see, this is pudendal now. Just look at the picture. And where would you give the log block? It is given to here. So, after giving pudendal block, you can easily create an opening, and that will help to widen the birth canal, and easy passage of fetus will happen. Okay, so please remember what is pudendal nerve, where is the location of pudendal nerve, and what is the indication of pudendal nerve. Okay, and why do we give pudendal block? That is usually given just before creating an episiotomy. Fine. So after blocking the pudendal nerve, the patient won't be able to identify the sensation at the perineum as well as on the rectal area. Okay. Regarding pudendal block, you will get questions. So please remember what is pudendal nerve and where is it is situated. See, here the fundal height is given, and by day, the fundal height is, they have given day by day what is the fundal height. And initially at the delivery, it was at the fundus, sorry, at the umbilicus, and then the fundal height is reducing. So this is called as involution of uterus. What it is?
Involution of
What it is
uterus.
called as involution of uterus. So when would this happen? Complete involution completes at what time? Involution completes at 9th to 10th day. Immediately at delivery, the fundus of the uterus will be at umbilicus. This is the position. Okay. On the time of delivery, it will be slightly above the umbilicus, and day 1, it will just come down the umbilicus, and one day by day, it will reduce by 1 finger breadth or 1 to 2 centimeter. It reduce, and by 9th day, the fundus won't be palpated on abdomen. So the uterus will be moved into pelvic area where it cannot be palpated. Here. So this 9th day, please remember what is involution of uterus unit. Just remember, and at what day 1, where would the fundus will be? Immediately after delivery, where would the fundus will be? See, please look at this picture, and the fundus is at a midline. Fundus is at a midline. It is not deviated. It is at the midline. Again, one more thing you can just write down. Deviated fundus, that means slightly tilted fundus, is indicating that bladder is also coming out. I repeat, usually after delivery, the fundus will be at midline and the fundus will be at umbilicus, midline and umbilicus. Okay, and slightly deviated fundus or tilted fundus. If this fundus and the uterus is located like this, it is indicating that bladder is full and it is came to the abdominal cavity. So how do you manage? You have to empty the bladder. Okay. Again, at delivery, the position. Day 1, position. How should be this uterus? It is on midline and at umbilicus. And after 9th day, the uterus or the fundus cannot be palpated. Okay. After delivery, you have to assess for discharge. It is lochia. Already we have discussed all of these things. Lochia can be divided into 3 things. Lochia rubra, lochia serosa, and lochia alba. Lochia rubra, serosa, and alba. The color is also same. Lochia rubra, it look like a red in color, and serosa, brownish to pink in color, and lochia alba, which is whitish yellow in color. Okay, days also please remember, first 3 to 4 days, and lochia serosa first 10 days, and then 11th day to 14th day and long till 21 days. You can see lochia alba. So color, name, and the day. Okay, 3 things you need to remember. Fine. This is also very, very important. Lochia rubra, serosa, and alba. This is fundal height during pregnancy. Initially, we have discussed fundal height after delivery. This is fundal height after delivery, which is indicating involution of uterus. And next, what I am discussing is fundal height during the pregnancy. Okay, at 12th week of gestation, this is 12th week of gestation. So this will be at the symphysis pubis. 20th week of gestation at umbilicus. 16th week of gestation just below the umbilicus and just above the symphysis pubis. 22nd week of gestation above the umbilicus. 28th week of gestation or 26th to 28th week of gestation below the symphoid process. Okay, so 38th week of gestation at the level of symphysis. 36th week of gestation, it was on symphoid process. 38th week of gestation, it is regression of the fundal height. Like normally 38 week, either it comes down or above the xiphoid process. And 38 to 40th week, usually it comes down. Okay, so please remember